Okay, let's dive in. Today, we're looking at something pretty specific but really important, getting a testosterone blood test. Our guide here is mainly from Blood Test UK, and they've got a focus on St. Helens. We want to quickly get grips with why this test matters for your health, and how local access is changing things.
Right, and what we're measuring here is, well, you could almost call it the body's fundamental power juice, testosterone. It's vital stuff. It plays a role in, muscle, mood, bone health, metabolism, really across the board for both men and women.
So it's pretty crucial then.
Absolutely. And the big win with testing is catching problems early. If your levels are off, doctors can spot things like hypogonadism or maybe infertility issues in men, even PCOS in women.
Things like feeling really tired or losing muscle, those could be signs too.
Exactly. Symptoms like that. Finding these things early, well, it can head off bigger problems down the line.
That really seems like the key message for you listening. Catching these hormonal changes early. It's not just about feeling a bit off. It's about protecting your overall health and, frankly, your quality of life long term. So why St. Helens? You mentioned Blood Test UK highlights it. Is there something special happening there?
Well, the guide suggests that local places, both NHS and private clinics in St. Helens, have really streamlined things.
Streamlined how?
They've apparently focused on cutting down wait times. So getting the test proactively is just, easier for people right there.
Okay, easier access. And the test itself, is it complicated?
Not at all. It's actually very low risk, just a quick blood draw, usually from your arm. Very standard procedure. But here's where it gets interesting, particularly in places like St. Helens that are adopting newer methods. The science behind the testing has really moved on.
Moved on how? Better results.
Definitely more accurate results. We used to have tests that weren't always reliable, gave sort of fuzzy readings sometimes. Now many clinics are using advanced methods like liquid chromatography tandem mass spectrometry, LC-MS for short.
LC-MS sounds very high-tech. Why is that level of precision so important for just checking a hormone level?
Because it makes a huge difference. Think of it like going from a blurry photo to a high-definition one. Older tests could get confused by other substances in the blood, leading to wrong results, maybe saying levels were high when they weren't, or vice versa.
Right, especially at lower levels, like in women.
Exactly. Especially crucial for women or children or even men at the lower end of the normal range. LC-MS is super specific. It isolates the actual testosterone, so the number you get back, it's reliable. Your doctor can then make decisions based on solid data.
Okay, that makes sense. Precision matters. So, with this better testing available, who should be thinking about getting it done?
Good question. The general advice often points to men over 40, as levels can naturally start to decline. But really, anyone experiencing those persistent symptoms we mentioned.
The fatigue, muscle loss, maybe low libido.
Yes, exactly those. Unexplained, persistent symptoms. And for women, things like irregular periods or also reduced libido could be triggers to discuss testing with a doctor.
So it's about being proactive if you notice changes, or maybe routinely after a certain age for men?
That's a good way to put it. It helps stop a small hormonal imbalance turning into something more chronic later on.
And Blood Test UK had a tip about preparation, right? Something about timing.
Yes, that's important for accuracy. Testosterone levels are usually highest in the morning, so booking your test for the morning is generally recommended. And your doctor might also advise fasting, usually about 8 to 12 hours beforehand. Just no food or drink except water.
Got it. Morning test, maybe fast. Simple enough. So we've seen why this test is important, how local access is improving in places like St. Helens according to Blood Test UK, and how technology like LC-MS means we can get really accurate results now. Which brings us to a final thought for you to consider. Now that these highly accurate tests are becoming more accessible, should we maybe think about this differently? Should even healthy people without obvious symptoms consider making this basic hormone check a more regular part of their health routine? Something to think about.